Again, I'm talking with Dr. Samia. Dr. Samia, hello. How are you?
I'm good, thank you, Dr. Mark. How are you?
Yeah, very good. We are obviously we are meeting so often, and then we are talking also about cases that we have. And I always wanted to ask you. There's recently there is this topic of skin boosters coming up. What are actually skin boosters?
So, skin boosters are actually injectable treatments which I offer in the clinic. So basically, you're having skin boosters in terms of topical treatments, you get them in the market in terms of creams, you get them in serum forms. But when you come to a professional service, the boosters which I offer are in terms of injectable cosmetic treatment.
And I was wondering, so this is, are they lasting very long, and is it staying in the skin forever or so? Does it do any harm, or is it medically safe?
Yeah, they're pretty safe. We're using them, and there are studies that they are proven very safe. They are all approved. And apart from that, there are different types of skin boosters available.
But it's still important to come to a dermatologist if it comes to skin boosters or injectables, so that you can see if the patient is eligible for that. Or
yes, once a patient comes, we assess the skin, and then we devise a plan. And usually these skin boosters are required to be taken in forms of sessions. So I do them like every 2 weeks or every 4 weeks, and then they have to come for maintenance because it's an investment for your skin.
yeah. And what are the concerns that patients have? What are your experiences with patients?
Recently, I had one concern from a patient that because she's a vegan, so she was asking if skin boosters are vegan. Yeah, so this was something new for us. So we searched it up and everything, and one of the skin boosters, which is called Profilo, which only has hyaluronic acid in it. That was the best skin booster we advised to
for
her.
Vegan.
For vegan options, yes.
Yeah. But so there are vegan options for skin booster.
Yeah, Profilo, we can do it safely. So it only has hyaluronic acid, 32 milligrams, which is one of the highest constituents of hyaluronic acid seen in any of the skin boosters. Yes.
So this is good to know. So if you are a vegan person and you still want to boost your skin, what does it do actually, the skin booster? What does it boost? Do you look more fresh, or what is it?
Yes, it refreshes your look. So there are different kinds of skin boosters, as I said. Some of the skin boosters have hyaluronic acids along with peptides and with certain amino acids. So they are good for crepey skin, skin which has laxity. And then there are skin which needs hydration. When you are applying topical creams or serum, they work on the surface level. When we are injecting the same skin booster in the form of injection, we directly inject it into the dermis, so it reaches directly at the stage in the dermis, and it causes internal hydration which lasts long. It causes somewhat of lifting and collagen production as well. And then there's another skin booster which has salmon DNA, PDRN, polydeoxyribonucleotide, which is DNA which has been extracted from the salmon, and then studies show that it has regenerative properties.
Wow, that's amazing. You know so much about these skin boosters. I didn't expect that. What I was thinking is the word booster. I know that from rockets or so. That's something that goes with speed or so. Is it an instant result that you get?
Yeah, the hydration, you can see it immediately and instantly, and very effective for skin which has been, the barrier which has been damaged. It's called skin booster because we are directly injecting it where it is needed. So you skip the surface level, you skip so many layers of the skin, and you inject it in the dermis where it is needed.
I got it. All right. I was always thinking that patients have a problem and then ask you, do you also do aesthetics? But it's actually the other way around. They come for aesthetics and say, hey, Dr. Samia, I have this wrinkle here, and they say, can you do some Botox? And you say, of course. And then you find something which is actually more helpful to get the beauty from inside, or how do you call it? Yeah, the inner beauty.
Yeah, inner beauty. So aesthetics is basically how you look from outside, how beautiful you are. But from in terms of longevity, I say that it's your internal beauty. How healthy or how beautiful are you from your inside? Because once you see your organs are aging, you get everything on your skin. Like, it's the whatever's happening inside the body, you get the signs and symptoms picked up.
And there are, you have a wide range, a wide portfolio of assessments that you're doing, but also you do not only do the assessment for the assessment reason, you also take action then to help the patients to get a more healthy lifestyle. How do you do this?
One of the assessments or the management we do, we're offering peptides. Other than that, IV infusions I'm offering at the clinic. And in terms of peptides, we have a wide range of peptides available, but the ones which we use are GHK-CSU, and then we offer BPC 157, a lot of different peptides for different indications.
Can you see from the skin if somebody has, or guess if somebody has, let's say, allergy?
Yes. So there is a shine you get underneath your eyes when you are atopic or, having atopic tendencies.
Can you see if somebody had a bad sleep?
Yes, you get dark circles.
Yeah. Can you see if somebody is diabetic?
Yeah, for diabetes, sometimes the patients, they get acanthosis nigricans if they have insulin resistance. It is basically a thick, velvety rash, hyperpigmented. You get it on the neck, and you get it in your axilla, and then you get it on your knuckles.
Oh, so I didn't know about that. Would you be able to see if somebody has a kidney problem?
Yeah, so for kidney problems also you get different kind of rashes, and it also depends on what kind of kidney problems they have. So sometimes, if you have a high uric acid or, then it gets deposited in your joints, and then they come with swelling of the joints, and then they get these gouty nodules on your joints,
So baseline is you see a lot of things. What are the most important aspects of healthy lifestyle for a long health span?
So one is lifespan, is how long you live, and then it's health span, is how healthy you live. Yeah, there's a difference.
Yeah.
So for a healthy health span, we evaluate, like I evaluate different, the organs. We evaluate metabolic parameters, we evaluate cardiovascular, everything, the hormonal profile, we evaluate everything.
And what are you specifically doing if a patient comes to you?
In terms of, so first of all, I examine the face, because this is the main problem. They're coming to us with their skin issues. And then once we pick up something, then I go deep into the history and evaluate that what problems patients are having. And then we dig out everything, and then,
Do you do allergy tests?
Yeah. I do allergy testing. We have a full profile, like full panel of allergy testing in terms of food allergies, respiratory allergies, and skin prick test and patch testing.
Also, the microbiome is also important. So do you test that as well?
Yes, microbiome is one of the important parameters in terms of longevity. So I check for all the, the gut microbiomes and the quantity of the healthy microbiome, how much is it, or it is reduced, or it is, how it is, and then we treat it accordingly.
So let's say someone of our audience is coming to see you, and you don't find any major problems, no cardiology problems, no sleep problems, no metabolic problems. What is the action that they could do to improve their, you see basically only a tired skin or so. I heard that you are also treating the patients with peptides.
Yeah, peptide is one of the, revolutionary thing which is still under studied. We have a lot of evidence, but still under studies. So peptides are basically short chain amino acids. So there's a difference between protein and peptide. Peptides are short chain amino acids and proteins are long chain. So they are being studied that they are one of the influencers or signaling molecules which act on different kinds of receptors in our body, and then we have different types of peptides for different types of presentations or conditions.
Since they are not so studied, are they dangerous?
The safety profile is not that like it's dangerous, but there's still a lot to be studied. How we can, we have a limited number of studies there, and then we are using them accordingly, but there's still a lot to be studied.
So what kind of peptides to come to your mind which can be used safely right now?
So right now the peptides which we are using is, one of them is GHK-CSU, which is a copper binding peptide, and it is very good for skin aging, and patients, they like it. And in terms of muscle recovery, there's BPC 157. We also have the peptide which is very hyped these days is GLP-1, and for weight loss and diabetes management.
Okay, so if you want to have a treatment and an assessment, or first an assessment and then a very, very thorough assessment from a very good specialist, and then a treatment, you should come to see Dr. Samia in German clinic. You can help also with hormones, is it?
Yes,
Yeah.
the hormones as well.
Do you do also bioidentical hormone therapy?
To somewhat, yes, you can
Yes.
say.
I think there are so many topics, Dr.
Yes.
Samia, that we need to talk about.
Yeah.
And I would suggest that in the future we will talk about single peptides, because
Yes.
this is a very new topic. It's work out in the future for the patients. Yeah.
Yes.
This seems to be a very promising field.
Yes, it is. It is.
Thank you very much.
Thank you so much, Dr. Mark.